Hey guys, welcome back to Medical Coding with Blue. Today's episode is advice to brand new medical coders who are out there seeking jobs in the world. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. The question that I'm going to address today is questions about a brand new coder who is seeking a job in the real world. And I want to send a huge shout out to Kathryn. Thank you so much for your very well written question. And I like the many facets of this question. So since she wrote this very well and it was originally supposed to be for Q&A Tuesday, I was like, no, this needs its own episode, because to discuss what's in this email is really good when it comes to talking to brand new medical coders who are out seeking jobs in the world. Now, the thing is, before I get into the email, I want to say this. A lot of people are emailing me recently because there's a lot of new graduates, and there's a lot of people saying the word, I'm frustrated because I cannot find a job and I have been looking and everybody wants experience. This is why I tell you guys, you have to apply everywhere, regardless of whether they are asking for experience or not. When you are a brand new medical coder, this is what happens. This is why I say this in almost every time I'm talking about jobs. It is difficult in the beginning to get in. You have to be steadfast and you have to be determined. I have many viewers who are brand new medical coders who have gotten their jobs in the middle of the pandemic, and they're actively working as medical coders. So they didn't have to start off as clerks. They didn't have to start off as medical billers. They actually started off in medical coding. Why? Because they were very determined. They had a very good resume. They had a very good cover letter, and they went out and they actually applied, or went online and applied everywhere. There's a lot of things that go into applying for jobs, and especially when you're brand new and you don't have experience. Watch that video that I talk about cover letter tips for brand new medical coders, because even though I don't give an exact example of my cover letter, because I've been told that my cover letter was really good, I want you guys to be able to think on your feet and write a really good resume that comes from you, comes from your heart, because everybody has that kind of same language, like I'm a team player and I'm very detail oriented. No. You don't want to have the same rigmarole that everybody has. Yours needs to be very personal. You need to talk about why do you want this position. You need to talk about the things that you learn. You don't need to highlight the fact that you don't have experience in your cover letter. You need to make sure that you're highlighting your transferable skills in your cover letter. What is going to make, why would them hiring you be beneficial to them? Because it's all about the company, whoever you want to work for, all right? So that's the thing that you got to remember the most. But I'm going to go ahead and start by reading Kathryn's letter. Thank you so much again, Kathryn. And then we'll go ahead and get into the rest of it. All right, so her question goes like this. As I look for a coding position, I've heard you and many others suggest applying for positions in a medical facility to get your foot in the door. My question is it best to be upfront in the interview process about your desire to move to coding and seeing this position as a stepping stone towards that? Do all facilities welcome this kind of outlook on entry-level jobs? How do you know which facilities actually have coders at the facility, and which might be a dead end if you accept a billing position, but the coding is all outsourced to an outside company? Thanks for your input, Kathryn. All right, so I'm going to talk about the first question that she asked. Is it best to be upfront in the interview process about your desire to move to coding and seeing this position as a stepping stone towards that? If I'm being completely honest with you, I will say no. And the reason that I say no is because of this. Not to be deceitful. This is not to be deceitful. The thing is, your goal is to get in, right? And with medical billing, if that's where you want to start off at, with medical billing, if I'm a hiring manager and somebody comes to me and says, I only want to be here just to get experience so that I can move on to be a medical coder. Now, in my mind, as if I'm hiring, right, I'm going to say, I want somebody that is going to be here, that is engaged and wants to learn. I'm not concerned about your aspirations to be a medical coder. That's what a manager is going to be thinking, okay? I'm just being honest. I'm not concerned about that, right? I want somebody that's going to come in and be a hard worker and do a really good job and want to learn and work with the team and be able to do those things. That's what I want. So that's what you have to tell them. Now, the thing is, you can learn a lot by being a biller. There's so much to billing, and the world needs good billers. I will say that, because the thing is, when you look at it, how many times have you heard about insurance companies and these patients that are going broke because the billing was incorrect? This is why there's those detail-oriented people that are needed for that. So if you're going to start off in billing, do what you can to learn. They know that you're a medical coder based on what you have on your resume. But don't talk about the fact that, hey, I want to use this to get into that. Do your own thing and sort of keep that information to yourself. You have to adopt that, tell people things on a need-to-know basis. Does this employer need to know this? No. What they need to know about you is that you are ready to learn, that you're excited about being in the health information management field, that you have a new set of skills, that you have medical terminology, anatomy and physiology. You've got lots of transferable skills. You've got good customer service skills. Customer service skills is going to translate later when you try to become a medical coder to talking to your providers. Because, as I've said before, talking to providers, it is like talking another language, because they are so incredibly intelligent. And you have to bring your A game constantly when it comes to dealing with providers. Now, when you're dealing on the billing side and you're having to deal with these patients who are irate, who don't understand why their bill looks like this, or what are you charging me for? I'm sick, and why are you giving me all these charges? And if you are able to explain to them, this is the charge that you got because of this, and this is what your note said, and be able to explain all these things to them, you may be able to calm the patient down, or whatever, if you're doing the billing, like the collection side, you know what I mean? Which may be one of your tasks. I don't know. I haven't done billing, but I would assume that that's part of it because you're a biller. And it is said in the job listing descriptions too, talking to patients and things like that. So having those skills, and if you're coming from a place where you've already had really good customer service skills, that's going to translate into a transferable skill that you can give to that billing company. There's so much that you can learn from them. And when you're learning from them, if they take a chance on you, be grateful for it. Because even though you may say, well, I didn't want to start off in billing, but if you start off in billing, if that's where your journey begins, that's where it begins. And that's okay, because everything that you learn from there, you're going to be able to translate it when you go on and you become a medical coder. But keep things to yourself, my people. Don't say things that is going to make you look like you're trying to be an opportunist, right? You don't want to look like an opportunist. You want to look like you are there and ready to and engaged, which you are. That's not being deceitful. You are there and you are ready to learn all of these things. But you have to be careful about the things that you say. You want to be able to present yourself in a good way. Don't overshare. All right. The thing that you should be bragging about is your anatomy and your medical terminology knowledge. All right. And knowledge that you have about reading the guidelines for CMS or anything, right? NCCI and all this. That's what you need to focus on. That's what you need to showcase. Showcase everything that you've learned. Don't highlight the fact that you don't have experience. And with billing, the great thing about billing is that you don't have to be certified to be a medical biller. But then you go strolling up in there with your medical coding credential. Hey, that looks good, right? So let's highlight it, but don't emphasize the fact that you don't have experience and that you're using that position to get experience. At least that's my advice. And the next part of this question is, do all facilities welcome that kind of outlook on entry-level jobs? They're not going to say that, hey, we want to be a stepping stone for your professional aspirations. They're not going to say that. So again, just make yourself to be what you're going to show is the fact that you are ready and you are excited about being in the health information management field. That's what you need to focus on. Okay, and then the other part is, how do you know which facilities actually have coders at the facility and which might be a dead end if you accept the billing position? So here's the thing. When it comes to that, no job that you get in health information management side is dead end. None. Because you can take that experience of being there and being a biller, and you can still continue to apply at other places. Hey, I was a biller here, and this is everything that I've learned. I've learned how to look at the claims, to spot errors. I've rectified errors, so on and so forth. That's what you're going to be able to transfer over to another place. Now, you may not be working in that same facility, especially if they are outsourced to an outside company, which was the last part of the question was, but all the coding is outsourced to an outside company. That may happen. Sometimes even the billing is outsourced, right? Is all just in one house. We in the town over, we have a billing company that is a freestanding billing company, and that's all they do is just billing for the area hospitals and doctors' offices. So that is where a lot of people got their training before they became medical coders, and some were brand new medical coders, and that was where they started. So learning everything that they did there, they took their experience and went on. You have to be at a place mentally where you're constantly either going to keep applying someplace else, like for an entry-level medical coder job, or you're going to stay there for a certain amount of time, maybe a year, sometimes 2 years, and then you can take that experience at that time when you've completed your experience and move on to other positions, other places. But you can always apply. And like I said, no position in in the health information, I was going to say medical coding, in health information is ever going to be dead end, because it is going to lead you somewhere else. But you just have to know how to put it on your resume, everything that you've learned and all the things that all the skills that you've acquired during that time. What kind of software did you use? What kind of things did you create any new programs or anything like that, as far as like documents that would help workflow or whatever? That's what you want to be able to highlight when you're trying to transfer these skills. And something else that I want to address on this video is the fact that sometimes people are asking me if practicode, which is an AAPC product, can be used as 1 year of experience. Now, if you don't know, practicode is a product of AAPC, and they offer this to help remove the A faster, right? Because the CPC, when you get your CPC, it has -A at the end, right? And in order to move this A that is for apprentice, in order to get that removed, you have to do a 2-year commitment. And so in order to speed up the process, they offer practicode. Practicode can be done during the program, or it could be done after you get done with the program. It could be done simultaneously while you're working out in the field, so that you can, if you're working in coding and you're working with practicode, 1 year's time, you can get that A removed, because that practicode is, I guess, their time requirement of 1 year. That is their time requirement to remove that A. This does not translate to practicode is 1 year of experience. When you're putting things on your resume, you can put that you have practicode because it's great education, right? It's great education because it's a lot of coding exercises and scenarios and things like that to help you get more confident with your coding. It does not mean that you can put this as 1 year of experience, because when the future employer asks you, how much experience do you have? And you try to say 1 year, okay, great. So what was your accuracy and what was your productivity? And if you can't answer that, which you cannot, because practicode is an educational program, that is the difference there. So don't try to do that, guys. They're going to know that you don't have experience that is just with practicode, and that does not count. For some places, education does count. So that may be able to translate, but not the fact that you're trying to say that I have 1 year of experience working, because a lot of times they'll be very specific about what constitutes experience, work experience. Sometimes they will say, well, internship will suffice. Sometimes people are working like 6 months internship, okay, or externship, and they'll count that as experience, but not counting practicode as work experience. It is not, okay. So I want you guys to know that there's a lot of things floating around about that, and I want to make that clear, because when you are going to these employers, you want to look as polished as possible. You want to look like you know, right? And you have to do that by starting to do all of your research. A lot of the questions that come in, some of them I know can be answered by just doing a simple internet search. So before you're asking questions, make sure that you're doing your research. And yes, sometimes it is hard to find some of these answers. And by all means, go ahead and send that question in. But the basic, simple questions of, well, I need to know this and I need to know that, guys, you can go to the association websites and find that stuff out. So that would be what I recommend. I'm going to leave some links to some videos down in the description box below. Again, guys, I really hope that you will consider looking at those. If you want somebody to look over your resume, I do offer professional coaching. Now it's $25 per hour, and you can contact me and we can set up a Zoom meeting, and I will review your resume and your cover letter and give you some tips and talk about some interview tips as well. I also, as part of this, I can do mock interviews. So I will sit there and ask you questions, so that way maybe that will help you to go over any sort of fine-tuning you need to do when you are getting ready to start doing interviews. So if you're interested in that, I will be leaving my email address down in the description box below. And so I'm going to go ahead and wrap this one up. Have you hit that like button yet? Have you subscribed to me? If you have, I totally appreciate it. Thank you guys so much for being here. The more you guys share and the more you guys tell me that you appreciate my videos, I can't tell you what this means to me. So thank you guys again. And I hope to continue to bring you more really good content. But I hope this video has helped. The road to finding a job in medical coding can be a bumpy one. I'm not going to lie there. But it's not impossible. And the reason that I know it's not impossible, because I did it. And I know that there's many others that are doing it every single day. So if you're out there, do not give up. When you're out there trying to look for a job, make sure that your resume looks good. Make sure your cover letter looks good. Make sure when you're in these interviews on Zoom that you are doing your best to be as relaxed as possible. Because remember, they're there and they're probably nervous, just as nervous too. But you want to have the mindset and get into that right mindset that you're talking to an old friend. And that should help you to relax, okay? But don't give up on your dreams. Don't give up on finding a job as a brand new medical coder, because it is possible, all right? So watch those videos about the job listings explained, because I do talk about the different alternative names that they use when they're looking for medical coders. I'm just saying. I'm going to wrap this one up. If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!